6 things the color of your period blood says about your health. While what's normal for one woman may not be normal for another, there are a few changes you should watch out for, particularly when it comes to the color of your flow. Below, find 6 things your period blood is trying to tell you about your health. If it is pinkish, you may have low estrogen levels. Studies have found that excessive exercise can lower estrogen levels, which can subsequently mess with your period, sometimes causing it to disappear altogether. While this may not seem like a big deal, low estrogen levels can increase your risk of osteoporosis if left untreated. So if you've recently started training for a marathon, have started working out for the first time in your life, or have upped the intensity of your workouts and you notice that your periods are suddenly lighter in color and flow or less frequent, talk to your doctor. If it is watery looking, you may have a nutritional deficiency. Diluted flow can be a symptom of severe anemia, especially if you notice your period getting lighter and lighter when it would ordinarily get a bit heavier. If after monitoring your period for 2 or 3 cycles, you are worried that this could be the case, talk to your doctor about getting tested for nutritional deficiencies. To make matters a little more confusing, an iron deficiency might instead be caused by heavy periods. If it is dark brown, you may have older bits of uterine lining and blood that are just now making their way out of your body. But don't panic. This is normal. We are not sure why this happens in all cases, but sometimes the blood is sitting around for a while and comes out particularly slowly, doctor says. It has a lot of time to oxidize, which is why it can look brown or almost black. Just make sure you see your OBGYN if you experience any of these period symptoms. You may have low progesterone levels and high estrogen levels. While some clotting is normal, clots the size of a quarter or larger can indicate a serious hormonal imbalance. Doctor recommends reducing your consumption of dairy, soy, and sugar and seeing if that makes a difference. Uterine fibroids are another possibility. They are most often benign, but they can be painful, so if you suspect they are behind your heavy, clot-filled periods, ask your doctor for an ultrasound. If it is a mix of gray and red, you may have an infection, such as an STD/ST. You will probably also experience a really foul, necrotic stench, doctor says. Get tested so you can get the right treatment. If it is a bright, cranberry red, you may have a healthy, regular period. Again, everybody's normal will look different, but generally speaking, a consistently bright red flow that looks a little like cherry Kool-Aid is a signal that everything is working as it should.